Hi, this is Dan Brown. I'm the Senior Service Consultant for MGE, and we decided to go ahead and give you some marketing tips on what you can do right now. Effective, simple, and low cost, if not no cost, marketing tools to help you expand your practice and get more new patients. Don't know if you realize this, but the consumer today is far different than the consumer 20 and 30 years ago. For us that have been around forever, there used to be this time where we would just walk up to, whether it's a car lot or walk into a store to buy a new TV, and that would be the beginning of what we would call the sales cycle. So the sales cycle is, let's call it 0 at I'm thinking about it, maybe I should get a new car, all the way to 100%, meaning I'm driving off the lot with my new car. That's the sales cycle. Now, 30 years ago, a person would contact a representative of the company somewhere between 8 and 12% through the sales cycle. Meaning, a person would get an idea, buy a car, get a new TV, get a new washer and dryer. We're talking about a major purchase now. And that individual would do a little bit of homework and such, and then they would show up and talk to a representative of the company for the first time, somewhere about 8 to 12% through the sales cycle. How is that different than today? Well, let me ask you this question. I want you to leave a comment below. Let me know what you think prior to me giving you the answer. How far is a person through the sales cycle before they pick up the phone to call that car lot, to buy a new washing machine or dryer, or to show up at Best Buy to get their new flat screen TV? Put a comment below on what your guess is. Be honest now. All right. Whether it's buying a new TV, buying a car, or investing in veneers, purchasing Invisalign, getting a smile enhanced through a full mouth rehabilitation. Whatever it is on those things, the consumer today is actually operating at around 88 to 92% of the way through the sales cycle. What does that mean? That means that person is doing a significant amount of homework long before they pick up the phone to talk to your practice or look you up online. Maybe that is looking you up online. Maybe they're looking at your website. Maybe they're doing the homework. But before they talk to you, where they fill out a contact form, pick up the phone and talk to you, or walk in your doors, they are somewhere between 88 and 92% through the sales cycle. Here's the next question. Where are they getting that information from? If a person wants to know about veneers, if a person wants to know about Invisalign, if a person wants to know, do I really need 6 crowns or could I get away with just getting my cavities filled? They need to be able to ask these questions and get answers to these questions, and it needs to be available to them on their time and on their terms. This brings me to the next question. When is that person doing this research? At night, after they've put the kids to bed, and that's after they've cooked dinner, cleaned up, done homework with the kids. That's after they've had a long day of arduous toil. And this is our public today. Our public today gets their me time somewhere around 10 to 11 p.m. at night. If that's when they're sitting down and they've just moved to your community and they're typing in dentist near me, can they easily find you? Can they get acquainted with you? Can they check out your practice? Can they find out who you are? What's the practice culture? Are you friendly? Are you happy? Do you like working together? Do you offer the services that they're looking for? This is the time that you better have all that information available to them. In this marketing series, we're going to tell you how to scratch that itch for your public. And it's very important to think like this. The public today wants to, on their time and on their terms, sit down and research you without having to talk to you, without having to walk into your practice. That could be at 11 o'clock at night when they're in their bathrobe sitting in front of a tub of Haagen-Dazs. That's their me time. And you need to make sure that you're available during those times. So, question for you, do you think that you're able to answer your public's questions and fulfill their needs and have an online presence that covers answers to their questions? Do you feel you're totally prepared for that? If not, we're going to tell you that you need to come to our MGE 2-day workshop called the New Patient Workshop. This isn't just a commercial for the workshop. I'm telling you, we take 2 days to walk you and your staff through key principles about online and offline marketing, but contemporary marketing basics that you need to know. We're going to give a link below so you can find out more about that workshop. But we're doing it in so many different cities throughout the United States now that there's really no excuse. And factually, I can tell you right now, you can't afford not to attend this workshop if you have questions on this point. I'm going to continue this marketing series. We're going to help you out. We're going to give you tips. Nothing's going to take the place of a 2-day workshop that's going to cover these points in total and in full. But I really want you to join me. I hope you enjoy this, and we'll look for you at the next tip.